You can see that. Where will you try and find this information?
Chart.
The chart, but which section of the chart? Well, I will always look if PT already see the person, okay? Because a lot of that kind of information has already been gathered. Because think of this, if you're that patient and everybody says, "Good morning, Mr. Smith, where do you live? Do you live in a house or an apartment? Do you have stairs or do you have a walk-in shower or a tub shower?" Everybody asks the same questions. How would you feel? You would think, this hospital doesn't know what they're doing because there is no communication and nobody's talking to each other. Okay? So before I go in, especially with hip replacements, why am I saying that? Because PT see them first, always. PT needs to see them 1 day post-op. OT orders is usually for day 2 post-op. Okay? I don't know the protocols of all hospitals, but that's usually, OT is usually later. So the PT has already seen the person. So you can get a lot of information from there, correct? But I'm still looking for more specifics. What are you going to do with this person? Are you just going to talk to them? Huh? What are you going to do with this man with his hip replacement? You're going to just let him lay there and you talk to him and then you say, "Okay, thank you, bye-bye." You're going to get him up, right? So if you get him up, what do you need to know? Yeah, we talked about that. I'm not worried about that. How big is this person? What is his weight and what is his height? Why?
So
And then I look at I see he's 6 foot and he weighs 300 pounds.
call Jamie.
And PT says he's a max assist. Okay? Or you need to know what kind of device you need to bring in people, right? Because you cannot let the person sit up and then you say, "Oh Lord, I forgot the washcloth. Oh, I didn't bring a towel. Oh, you have to go in there extremely prepared. I know it's 9 o'clock in the morning. I'm going to set him up. I'm probably going to brush some teeth, wash some face. So I gather my supplies. I go in there with a clean draw sheet, a clean set of sheets, or I walk by the room and I glance in to see what's there and where is he right now. He's laying in bed, he's fast asleep, or he's busy eating breakfast. I usually walk by the room first, just to glance to see what's going on in there. And then I go and get my supplies so that I walk in there completely prepared. Because I am not willing to get him up and then sit him up and then have to lay him down because I forgot something. Because that's what you have to do. You can say, "Oh, just hang on, I'll be right back." Okay? So be extremely prepared. Make sure that there is a walker in the room. Sometimes in some hospitals they will leave the walker with the patient, but most of the times they take them out. So you want to make sure if you're going to plan to do a transfer or whatever, you want to sure that you bring a walker in. And what else? Gate bell. Okay. All right, so that's just basic things that will impress a therapist or make them think, "Wow, where did they come from?" Okay, so those are just basic things that I need to know before I walk into that person's room. Got it? All right. So let's walk through. I need a person who is a hip replacement, who's not sick. Okay? You have to take off your shoes, please. So, let's say, in this case, you are a right hip replacement. Why am I doing that? So I'm standing on this side and we usually transfer the person towards the side. You can lay down. Towards the side that their hip replacement is on. So I'm just not choosing to do it on that side. So when you walk in, the person is probably covered, and they might have a wedge pillow between their legs, right? You know that. They might have a catheter, okay, which might be on that side of the bed, and they might still be on an IV of some sort, okay? That can also be on that side of the bed. So first of all, again, when you walk in, observe all these things, because if that is the case, I want to make sure that I bring the back towards the side, and that somehow I am going to bring the ivy pole around. Okay? Now, sometimes the cord is not long enough that you can bring it around, so somehow you need to hold it up and move the pole and bring it around, or get some help, but you know, you can dislodge the ivy, but you need to bring the pole to this side. Or he's on oxygen. And if you're then planning the person to walk the person into the bathroom, you either have to get an oxygen tank, which always have to be in a cart. Those little push carts, you've seen them. You cannot use oxygen without that tank. They will escort you out of the hospital. Because if that thing falls over and it explodes, it will blow through all these walls. Okay? So if the person is on oxygen and you can't really take the oxygen off, most of the time you just unhook the nasal cannula. But if the person really needs it, you might want to get a 10-foot line, or how long ever they are, so that you can walk them all the way into the bathroom with the line. Because I would hate to go and get an oxygen tank, hook that up, just to walk to the bathroom and back. So those are decisions that you also have to make. So, first of all, what I always do is say good morning.
Good morning.
Can you please state your name for me?
Lexi Shapiro.
Okay, I'm Nicholas. I'm your occupational therapist for today. Can you also state your date of birth for me?
June 5th, 1990.
All right. How's your pain today?
It's okay.
All right. Did you get any meds this morning?
Yes.
So you think we can get up?
Yes.
It's all good. Okay. Can you just make sure that your robe, what do you call it, hospital gown, is all the way down under the blankets? Okay.
Yes, thank you, sir.
All right. So, and I'm going to draw the curtain so that we can be private. And now I'm going to remove the sheet. Is that okay?
Yes.
Okay, so I remove the sheet. All right? And by now I have my gloves on. All right? I've washed my hands outside. I walked in, and I can also start talking to the person. Remember, we did all of that, washing your hands and putting your gloves on. Okay? So now I might go and say, you know, I just want to move the catheter back from this side to this side. All right? Don't hold it up here. You need to want to keep it low. Otherwise, the urine flows back. All right? If it's too full, you want to empty it. Especially if you're going to walk the client, because then you're going to hook it here on the walker, right? Emptying is not in your scope of practice. So you can either ask the nurse to do it, or your supervisor. In some hospitals, the therapists do empty it, but they empty it in a specific way. If you walk into the bathroom, there is usually a triangular, clear plastic container that you can measure. So if you do empty it, and make sure you know how to unclip it and clip it again, and do it with gloves, although urine is sterile. Did you know that? You want to then measure it in that cup, and you want to then report it to the nurse to say there is 200 mLs of urine. But don't just do that, okay? Find out how it is done where you work. Do you call the nursing assistant for it, or does the therapist do it, or do they allow you to do it? But, you know, you want to make sure that thing doesn't explode while you're working with it. So I'm going to bring the IV, the urine back, and then I usually hook it here, right here, because there's like a opening there in the frame, so that it hangs there. Okay? and then I bring the ivy pole around so that when I get up, everything is ready to go. Okay? So now I have to do an assessment. Now, remember I did that little thing with you where I ask what is the two first things that you will assess if you have this patient, client. I was getting worried that you guys are missing the boat on occupation-based occupational therapy. Because I work with the purple class and all I hear coming out of their mouth is range of motion, muscle testing. So, 95% of you, your answers was occupation-based. Only 5% of the class had answers about their first things that they will assess, observe, evaluate as completely biomechanical. Okay, so very good. I was very pleased to see that. Okay, so so I have to start somewhere. All right, so can you tell me a little bit about your hip replacement and how did you end up here?
Yes, I fell in my driveway and just recently had surgery, posterior hip replacement surgery.
Okay, so how did you fall?
I tripped over my dog.
Okay, is that your first time that you fall or have you had other falls before?
I've had other falls.
Okay,
Just minor falls though.
around the house?
Yes.
In any particular place?
Usually in the kitchen.
Okay. Do you get dizzy or is it you trip over something all the time or?
Yeah, I'm kind of not very organized, so I'm tripping over things.
Okay. Very important information right there. Okay? Because this person might go home. We don't know a lot about this person, but this is something I have to address in the long run. Okay? So, tell me a little bit about your home. Is it a house or an apartment?
It's a house.
Okay. Is it how many bedrooms?
It's 2 bedrooms. There's stairs, 2 stories.
Okay, it's on 2 levels.
Mm-hmm.
All right. And do you still go up and down the stairs?
Yeah, my bedroom's upstairs.
Do you use any devices when you walk?
No.
No.
Just hang on to the railings in the wall.
Okay. How about do you live with somebody? I see you married.
Yes.
Okay. So how's the health of your spouse?
It's good. He's nice and muscly, so.
Okay. So when you go home, he will be able to assist you with certain things?
Yes.
All right. Do you have any other equipment at home? You know, sometimes people have raised toilet seats or they have bars. Do you have any of those kind of things?
No.
So no cane, no commode, no raised toilet seat?
No.
Okay. Tell me a little bit about your shower. Is it a tub shower or is it a walk-in shower?
It's a tub shower.
A tub shower. Does it have curtains or sliding doors?
Sliding doors.
Sliding doors. And when you shower up till the time that you fell, do you always stand and take a shower?
Mm-hmm.
Okay. So you stand there and wash yourself.
Yes.
Do you have any thing in your tub that is makes it non-slip, like one of those mats or those strips?
I used to, but it didn't really stick anymore, so I took it off.
Okay. All right. So good information. So you still have a dog,
Yes.
and is he small? Is he big?
He's big.
Do you still walk him?
Mhm.
Okay.
Not as far as I used to, though. Just around the block.
So let's talk about the things that you really like most to do during the day.
I like walking my dog. I like to cook for my husband. I like to garden.
Do you do house cleaning?
Yes, I do some house cleaning. I like to surf the web,
Okay.
the internet.
Yeah.
And I like to travel, but I don't really travel anymore.
And in terms of being able to shower and dress, you've been doing those things all by yourself until this point that you're now in the hospital?
Yes.
Okay, very good. All right. Okay, so what would I do next? Do you see why I've asked all those questions?
Mm-hmm.
And it didn't take me more than 5 minutes or so but all of that